your mind of each plan, including the impact each plan would have on overall healthcare costs, and which would you choose and why?
That's a pretty comprehensive question.
We didn't promise you easy ones, sir.
I think politics is the art of the possible. And the reality is, when this debate got started, in fact, during the campaign last year, I think there was general consensus, at least by President Obama and I think by Senator McCain as well, that we ought to take the current system we've got and improve upon it and fix the problems in it, rather than throwing it out and starting again. And that was a decision which was made that time. That has been the consensus view coming forward here, and that's sort of what we're dealing with. I mean, I read these articles about what a radical reform of the healthcare system is being contemplated. I don't know that that's the case. I think that what we're talking about is fixing problems in the current system, expanding coverage, making the current system work better. So that's by way of preface to the fact that single payer, which would involve the elimination of private health insurance in our country, that is not being considered either in the House or in the Senate, and I don't think it's politically doable. So that's just the reality of that. Now, what was the second of the options you mentioned?
The public option.
Well, the public option. The public option, I've said before, I favor the public option. I voted for it. I helped develop the one we put in the Health and Education Committee bill, and that would be one option. I mean, people sort of lose sight of that, but it would be one of the choices that people could make in deciding where to obtain their health care coverage. And I think that would be a good thing. And I do think, as the President has said, it will help ensure that the private companies that are selling health care will have to take into account the cost that the public option is offering health care coverage for. So that would be good. I think it'll help us keep down premium costs. The co-op, I've also addressed that a little bit. I don't think it's as good, but I think depending upon how it's implemented and who comes forward and says, okay, we will operate as a co-op and we will go from state to state and get licensed and just function as a co-op, I think it could work. It could be effective. If you had a form.
The other was Medicare for all.
Medicare for all, as I said, I think a lot of people think that Medicare for all is the public option. It is not, and I don't pick up any real sentiment in Washington for putting an additional tax on the American people through payroll tax or otherwise in order to take those funds and begin or essentially expand Medicare to everybody. I don't think that's not in the House bill, it's not in the Senate bill. Either of the Senate bills being developed.